Hi, I'm Kathy O'Regan. I'm on the faculty, on the policy faculty. I'm the director of the public and nonprofit MPA program that we have, and I teach courses in policy on economics and housing and urban areas. My mother was a public health nurse who ran a free health clinic in a set of projects in Providence, Rhode Island. And so most of my formative years were spent going in and out of the projects and seeing what those areas of concentrated poverty were like, and hearing the stories of what it meant for the lives of the people who were raised in that neighborhood. I'm really interested in areas of concentrated poverty, the neighborhoods that poor live in, what happens to those neighborhoods over time, what types of policies and interventions we may come up with that help change the trajectory of the neighborhood. And I'm motivated by the fact that in this country in particular, the opportunities in life come through our neighborhoods. So by being raised in a neighborhood of concentrated poverty, a child's life chances as an adult decline. And so I'm interested in changing that. Sometimes people accuse me of studying something that's very depressing, poverty, inequality, that's depressing. You can turn it on the head, which is any small difference you can make in this area changes thousands of lives. It's really important when you do research that you get generalizable lessons, not what should we do in Harlem, but what should we be thinking about? So I do a lot of work where I'm looking at thousands, hundreds of thousands of neighborhoods across the country. So in the US now, we have one major supply-side program. And supply means we go in and we create the affordable housing in the neighborhoods. And this program replaces public housing, which we got rid of because it concentrated poor households and created terrible neighborhoods. And this current supply-side program has been accused by fair housing advocates of doing the same, of concentrating minority households in very bad neighborhoods. And it turns out, in a very simple story, you might expect it to be doing this, but that's without looking at the data. Who's in the housing, where they would live if they weren't placed in this housing, and then what happens to that neighborhood over time. Because over time, it turns out the neighborhoods that receive this housing, over time, the lowest income neighborhoods get better. They deconcentrate in terms of poverty, they deconcentrate in terms of racial concentration. So if you take a snapshot look in a moment, it looks like a bad program. When you take a look at it holistically, it looks as though in fact may decrease racial concentration. And our research has been read by people at HUD and IRS, which oversees the program, to see whether or not they should be changing it. And on the demand side, what we use are vouchers. So these are an income supplement that can only be used on housing that's of reasonable quality and not too high rent. And the households go and move into neighborhoods. And there's been a causal assumption made that if we give vouchers to households and they all enter a neighborhood, the neighborhood declines. And it turns out they got it wrong. Crime goes up, the voucher holders can then afford the neighborhood and they move in. So in terms of thinking about it as a vehicle that we can use without great concern about the side effects, vouchers is still a good idea. When I think about the impact that I want to have on my work, I want the neighborhoods that the poor are raised in to be better. I want fewer poor households to be raised in neighborhoods of those extremes and for there to be more opportunity. And so the work I'm doing now on housing gives me an avenue to improve what is at the federal level our main mechanism for changing the spatial access that poor households get to opportunity. My other prong is my students, because my students are going out there and they're working on those neighborhoods. And I take that impact statement as seriously as I do my research statement.